How do you interpret CF genetic test results? Interpreting cystic fibrosis genetic test results can feel overwhelming, but it's essential to understand what these results mean for you or your loved ones. The process involves looking at genetic data alongside clinical symptoms, family history, and other tests to make an accurate diagnosis or determine carrier status. Cystic fibrosis genetic testing primarily focuses on the CFTR gene, which is responsible for cystic fibrosis when two disease-causing mutations are present, one from each parent. If a person tests positive for two pathogenic variants, it usually supports a diagnosis of cystic fibrosis, especially when clinical symptoms and tests like sweat chloride testing confirm abnormal CFTR function. However, if only one or no mutations are found, this does not completely rule out cystic fibrosis. Some mutations may not be detected by standard testing panels or can have variable effects. Additionally, some variants may be classified as having uncertain significance, meaning they might not cause classic cystic fibrosis symptoms but could be linked to milder or atypical CFTR-related disorders. For those undergoing carrier screening, finding one pathogenic CFTR mutation indicates that the individual is a carrier. This means they typically do not have cystic fibrosis but can pass the mutation to their children. If both partners are carriers, genetic counseling is highly recommended. This helps assess the risk of having a child with cystic fibrosis and discusses reproductive options. When interpreting CF genetic test results, several key points should be considered. First, clinical context is crucial. Genetic results must be viewed alongside symptoms, sweat chloride test results, family history, and other CFTR function tests. Relying solely on genetic testing for diagnosis is not sufficient. Testing often begins with panels that detect common cystic fibrosis-causing mutations. If only one or no mutations are found but suspicion remains high, further testing like full CFTR gene sequencing may be necessary to identify rare or complex mutations. The classification of variants is also important. Variants can be classified as pathogenic, likely pathogenic, benign, or of uncertain significance. Only pathogenic or likely pathogenic variants are considered to cause cystic fibrosis. Some variants, such as R117H and poly-T tract variants, have variable effects and requiring careful interpretation. These are often reported together to assess their clinical significance. Carrier screening is recommended for all individuals planning a pregnancy or currently pregnant. This helps identify couples who may be at risk. If a familial mutation is known, testing should focus on that specific mutation. Genetic counseling plays a vital role in interpreting results and understanding their implications for health and reproduction. It guides further testing or management based on individual circumstances. In conclusion, interpreting cystic fibrosis genetic test results involves combining genetic findings with clinical and laboratory data. It is essential to understand the limitations of testing methods and to involve genetic counseling for personalized information and support. The diagnosis of cystic fibrosis or CFTR-related disorders relies on clinical presentation supported by genetic and functional testing, rather than genetics alone. Prognosis cannot be reliably predicted solely from genotype due to the variable expression of the disease. Always consult healthcare professionals for personalized advice and guidance.